Welcome back. The new batch of community service nurses and doctors welcomed by the health sector is barely a month into their training. Already, they have had to deal with the second wave of COVID-19. Since the beginning of the year, COVID-19 deaths and infections have been on the rise. Let's find out how these recruits are coping in the midst of this pandemic. Our reporter Nqobile Madlala is at the Heidelberg Hospital now. Nqobile, of course, a lot of these recruits coming into this job knowing how difficult it is anyway, and now to find themselves having to deal with the second wave and this new variant. What are they telling you?
Well, Maseko, I haven't spoken to some of them last week. We know that it's been a difficult time for most of them, but this has been a time where they have been tested in terms of can they serve and can they really do what they've always wanted to do, because it's a bit of a situation really, Maseko, knowing that this is the dream that you always had and walking into a pandemic. But Maseko, where I am, it's in Heidelberg Hospital. Of course, this is a level 1 hospital, meaning it's just after the clinics. So they don't have that much traffic, but they have had to deal with some of the COVID-19 cases. Joining me now is the CEO to just kind of explain to us how they have had to deal with COVID-19 from the beginning and how they have coped so far.
Good morning, Nqobile. COVID-19 came to us as a shock. We are not properly prepared to deal with COVID-19 because we are a small hospital. Our hospital has only 126 beds, and of those beds, we never had any ward that was designated for COVID-19. So in the first phase of COVID-19, we realized that all the patients are coming in, the bigger hospitals are becoming fuller and fuller. So we needed to start looking after our own patients. So we repurposed, of the 126 beds, we took 26 beds and we repurposed them in the first phase, and we used them as COVID designated beds. And those COVID designated beds, it means there were beds that are utilized for positive patients as well as patients that are still awaiting results. So we tried to make sure that we start training and educating all of our other staff members because we all needed to know what must happen because COVID-19 was new to all of us. We then had to make sure that we also get enough adequate support staff, adequate clinical staff to make sure that we cover and we are able to deal with the pandemic.
And it's obviously the second wave now. How are you dealing with the second wave?
With experience of the first wave, we realized that we had more and more patients coming in than the 26 beds that we had repurposed was not enough. So we had to enlarge our capacity and we had to make at least 44 beds. We could get 44 beds and make them our COVID designated beds. And our hospital, as a level 1 hospital, we don't have high care or ICU, so meaning we do not have critical care. But it has also taught us, it's a lesson that we needed to have proper care for patients. So we then repurposed 4 of the 44 beds and we had made them critical beds, which means we have added, we've had ventilators and ICU beds, and we've got staff that has been trained to make sure that they are able to look after patients in case of need.
And of course, some of these staff are the ComServes and the interns. How have you basically introduced them to the training of COVID-19 and how are they doing so far?
So far, we've made sure that there is training. In the first phase, we have made sure that we enroll some of them with Foundation for Professional Development, and they've been doing online trainings as well as even now there's still continuous development of staff in relation to COVID. And we always have a meeting every Thursday. We have a compliance meeting, which also includes some teachings. And we have infection and control management that also deals with training as well. We make sure that there are trainings that on all the new regulations and all the new things that come on, we make sure that we bring our staff on board and we educate them and we make sure that everybody is ready to deal with any situation during this pandemic.
Of course, that's very important, educating them to make sure that they are ready. But now I understand that you are dealing with compliance. Perhaps give me an idea on how you're dealing with the ComServes and the interns to perhaps treat them and show them how to comply. What is it that you're looking for?
Good morning. With the compliance that we are doing in the hospital on daily basis, on arrival, we let the staff to screen first. And then after screening, then they go to their wards where they work. In the same wards that they are working, there is enough PPE that they're supposed to put on before they can touch the patients. So with the staff that we have got from January, what we do, there's this orientation and there's induction of the staff of what is happening now in the hospital. And then each and every day, there's in-service training that we say the wards must do, so that these people must come on board each and every time, not to forget of what we are facing, what we are facing. And yes, we have been doing very well as the hospital in that way.
And are they nervous at all?
They are nervous. Remember that it's another situation. It's an abnormal situation. All of us, we come here in the hospital. We do not know what we're expecting for the day. But up until this far, we haven't had those ones or those moments that you say that the staff, maybe they've got a nervous breakdown or whatever. But we have been getting a positive response from our staff.
Thank you very much. Well, there you heard it, Masego. They're saying that they have been receiving positive response from the interns and the ComServes that have come in. We, of course, will hear from them as the time carries on. But then it seems like it's been an interesting time for everybody.
Well, thank you very much. We'll have to leave it there. That is Nqobile Madlala coming to us live from the Heidelberg Hospital.